right, so let's move on to healthcare. So could you please outline your ideal American healthcare system?
I think we need to have a healthcare system that ensures that every American has access to quality, affordable healthcare. And I think it is a basic necessity of life, and we have a responsibility to ensure every American has access to healthcare. And I think public option is the right way, a single payer system is the right way. I think, you know, what the Healthcare Reform Act includes are really important components of what I would see as a good healthcare system, where young people can stay on their parents' plan until they're 27, that we deal with the issue of the prescription drug donut hole and make prescription drugs affordable to our seniors, that we ensure that no one can be denied healthcare because of a pre-existing condition, and ensure that nobody is denied healthcare because they've reached their cap and are dealing with a chronic disease and they say, sorry, your money's run out and now you're on your own. Those are clearly components of it. But I think we have to ensure that it's a system which is available to all Americans. And I think we have to deal with the issue of, you know, the cost of healthcare. We have to be serious about how do we attack the cost of healthcare, but that's a healthcare system question. It's not a provisions question. And so there are things we can do. For example, our healthcare system should include a provision that allows the United States to negotiate for discounted prices with pharmaceutical companies, which can save tens of billions of dollars. I sponsored legislation to do that, written to Secretary Sebelius urging her to do it. Asked her about it actually one night over dinner. Why aren't you doing this? And she said, because Congress said I can't under the statute, which is crazy. I mean, the VA does it. There's no good explanation for it other than the pharmaceutical companies had a lot of money and lobbyists made that provision a part of it. But you know, we have to be looking at ways that we can reduce the cost of healthcare with investments in wellness and investments in technology and, you know, ensuring there's no waste and fraud, but not at the expense of the delivery of quality health services. And you can do that, and there's ample ways we can reduce the cost of healthcare, I believe, by making investments in wellness, by making investments in technology, the use of technology, and looking at things like the prescription drugs. But I think we need to protect the level of care, and we need to ensure, you know, I hope everyone wants to live in a country where everyone has access to quality, affordable health care. And the reality is, you know, when people say we can't afford it, the truth is we can't afford not to have it. We pay for it already. When people go to a hospital, we pay for it at a much higher rate. And so this notion of somehow, oh, we can't afford to do this, we can't afford not to do it, because if we continue to be a healthcare system where people wait till they have, you know, an infection rather than having something treated, the cost is tenfold. And we're paying for that in the context of uncompensated care, which means everyone else is paying for it. So I think, the ironic thing might be if the Supreme Court rules against healthcare reform, it might force the conversation about a public option or a single payer as an answer. So that might be the kind of wonderful irony of the Republican. Right? Right.
Sweet. Any follow-ups on healthcare? All right, let's move